Welcome, everybody. We're just going to give it a few seconds as everyone joins in from around the world. So thank you so much, everybody, for joining our session today. I'm really delighted you are able to come and make the time to listen to a little bit more about some of the work we've been doing on OPD ecosystems and capacity in Kenya and Pakistan. Fantastic to have you join us today and for you to hear a little bit more about this work from the OPDs that we've been working alongside, and just to get a little bit more reflection and narrative from, the depth of the learnings, and also the next stage, and the reflections we can have on the project, and also kind of how these OPD ecosystems and the learnings compare country to country. So I'm Louise Gebbit. I am the Director of Global Engagement for the Global Disability Innovation Hub, and I'll be hosting the session today. If we go to the next slide, please, Harrison. So just before we introduce the panel, just to let you know, there are closed captions available for the session. So please do look for the closed caption box at the bottom of the screen. It's a little square with two C's. If you click that, you should be able to see the live captions. There will be a recording made available, so we will share that after the session as well. And we can also make the slides available if those are useful to you. So you'll be able to catch up if you miss anything or if your internet drops out halfway through, as we all know happens sometimes. So I just want to get started really by introducing the panel today. So I'm going to ask the panel members to introduce themselves. It's much more interesting than me doing it. So we're going to start off with Atif. So Atif, maybe if you want to just turn on your microphone and camera and just tell us a little bit about yourself. Just try that again. Atif, if you'd like to just turn off your microphone and camera and turn on even your microphone and camera and introduce yourself, that would be fantastic. Hi.
Hi, hello. Thank you very much, Liz, for having us in this webinar. I'm Atif Sheikh, Executive Director of STEP, Special Talent Exchange Program based in Pakistan. This is a cross-disability organization, and we are a very proud partner of GDI Hub. Thank you very much.
Thank you so much, Atif. So wonderful to have you joining us from Pakistan today. I'm next going to go to David. David, would you like to introduce yourself?
Thank you very much. My name is David Osenya, Program Officer at Kilimanjaro Blind Trust Africa. Kilimanjaro Blind Trust Africa is a charitable trust that works in the innovation and technology space. We focus in inclusive education, and also we work in East Africa in 6 countries, that is Kenya, Uganda, Tanzania, Ethiopia, Malawi, and Rwanda. Thank you very much.
Thank you, David. Wonderful to have you here today as well. We do have an additional panel member, Paul, who I don't think is on the call quite yet, but hopefully will be able to join us for our panel discussion a little bit later on. So we shall leave Paul to introduce himself as and when he's able to join us. So we shall return to that. So we want to go on to the next slide, please, Harrison. So we just want to start by telling you a little bit about the Global Disability Innovation Hub. So the GDI Hub accelerates ideas for impact for a more just world for disabled people and all people. Next slide, Harrison. So we are a world-leading delivery and practice centre and academic research centre at UCL, which is University College London, and we're the first WHO Global Collaborating Centre. Let's see if I can say that right. Global Collaborating Centre on Assistive Technology. And in collaboration with global partners, we deliver accelerators and marking shaping initiatives, building ecosystems with a focus on low and middle income countries. So then I guess, how does this project fit into that? So this project we're sharing today is part of our 80-20-30 programme. So 80-20-30 tests what works to improve access to life-changing assistive technology for all. So we've reached over 64 million people in 61 countries since we began the programme. And this programme is funded by UK International Development and has been working for quite a number of years now on really exploring all the different elements involved in getting assistive technology to people that need it most. So some of that is technology driven, so that's innovations, that's research, that's data, that's evidence, and some of it is a little bit more focused, I guess, on the wider ecosystem. So work such as this OPD piece, such as capacity building, and really looking at those system strengthening and how all these individual elements are absolutely critical to create the impact that we need, and really provide those mechanisms for assistive technology to be more widely available, and for more people to be able to benefit from those technologies. So if we can move on, Harrison. So just a few highlights. So as part of the programme, we've delivered 203 journal articles, supported 40 and 80 ventures sustainably, had over 151 partnerships. So it's quite broad and it's quite global, and it's really given us the opportunity to do some big picture pieces, but also to really then hone in on do some quite deep research and evidence. And I guess that's probably where this piece of work came into play in terms of how we could really look in quite a lot of detail at really specific regional ecosystems of OPDs, and work with our fantastic OPD and country partners to explore and see how kind of that deep community leadership, engagement, capacity building, networking, and an opportunity could really help support this narrative around getting assistive technology to those that need it most. So this work sits in our cluster 1, which is include. There's 5 clusters to the programme, and that really includes all sorts of kind of community-based activities as well. So it's been a fantastic project to be part of, and we were so privileged to work alongside the Kilimanjaro Blind Trust and STEP to really kind of drive this program through it and deliver it as a bit of a test, really. It's a piece of work that, as far as we're aware, hasn't really been done elsewhere. So fantastic to start building those foundations. And I think what we've learned, and hopefully what will be showcased today, is that these very much feel like foundations. It feels like there's so much potential in this area, and we're just scratching the surface of what can be done when we bring OPDs together and we bring OPD leadership together. So hopefully a really exciting journey that we're maybe towards the beginning of, because I think we can all see and understand the value that can be brought, and the impact that can be made. Next slide, Harrison. So this work was really about looking at creating inclusive futures, and really focusing that it starts with empowering those at the forefront of change. So obviously organisations of persons with disabilities, OPDs, or in other countries such as the UK are known as DPO, disabled people organisations, play a really critical role in advocating for the rights, needs, aspirations of persons with disabilities. Next slide, Harrison. So the work we're going to discuss today had really kind of 2 focal points. So one of the focal points was around doing a needs assessment. So that was understanding the real world challenges that OPDs face in both Kenya and Pakistan, and was really focused on some kind of specific regions and regional analysis. So I'm sure our panel will be sharing a little bit more on that as we go through. But also looking at capacity building, so understanding from the needs that were identified in the needs assessment where capacity needed to be built, and how the project could help support and just start. And we're very much talking about the starting point of building that capacity within OPDs, and seeing how by creating networks and by creating relationships between OPDs, there was a real opportunity to be kind of bigger than some of its parts. So we're absolutely privileged and delighted to work with STEP and Kilimanjaro Blind Trust, who we'll be hearing from today. So I think that leads us to focus now in on our first country, I believe. Let's see, Harrison, next slide. Yes, perfect. Learnings from Kenya. So I'm delighted to hand across to David, who will be able to share a little bit more about, I'm not handing across to David. Let me get this right. So we are going to first, we'll see a video of some of the work that happened in Kenya, and then we'll be hearing from David afterwards. So let's play the video.
I'm Carol Joseph Semoyo, founder Smile for Neurodiversity Organization. This is an organization for parents with children living with neurological disorders.
I'm the chairperson of Jasiri Women Self-Help Group. Jasiri Women is a is a group formed by women with disabilities with one commitment and passion for advocacy. Our thematic areas are education, entrepreneurship, blue economy, and climate adaptation and resilience initiative.
What motivated me to begin doing advocacy for people living with disability, it all started with myself. Because during my time when I caught up with disability, the stigma was very high and also awareness was very low.
As a leader and other leaders, we are looking forward to embrace AI in our organizations, like in our daily activities. We can use AI in financial management, record keeping, telling our stories about our organizations.
Currently, we have policies, but these policies do not help us, because once these policies are violated, there's nothing you can do to enforce or take somebody to court.
Policies that we currently have require a lot of review. Most of them are very archaic, quite outdated, and quite prohibitive, to the extent that sometimes you may just think that policies are made to prohibit people from getting services.
If we can have a legal framework in the counties, all the 47 counties, that is enforceable, then we are sure also to be living in a life whereby we can enjoy the fruits of liberation alongside all the other citizens.
What I can just say to the decision makers and the partners that are now maybe listening to me is, number one, me, what I know can work for us is only acts. When we have a disability act, that will also be mandated even to the treasury, that they need to allocate the resources for us. It will be so nice.
The first thing that we need to change is our perception towards people living with disabilities. Most of us take them like sometimes beggars or people who can't be productive. If we are going to change that perspective towards them, we're going to have a world that is inclusive to everyone and that can accommodate everyone.
Me, as Faisal Lokech Abdallah, I want to thank Kilimanjaro Blind Trust and GDI Hub for bringing this initiative of bringing OPDs under one umbrella so that they can understand our challenges and how we can overcome them.
As Emily, and on behalf of our organization, Amazing Group of Persons with Disability, my message to the Kilimanjaro Blind Trust Investment of GDI is that this is the opportunity that we've been looking for. For long, we've never found an organization that has brought us together on board the way you guys have done. Our minds have been broadened, and even with the support we are giving to some of our institutions or organizations already, has really capacitated our disability.
Thank you very much, Louise. Thank you very much, Harrison, for the video. Indeed, the video captures the feedback and the insights from people, the representatives of organizations for persons with a disability here in Kenya. And I want, first of all, to appreciate GDI for partnering with Kilimanjaro Blind Trust Africa to build a disability inclusive environment for OPDs, and also to strengthen the capacities of organizations of persons with a disability here in Kenya. The OPD capacity building for a disability inclusive future project here in Kenya was actually aimed to strengthen the capacity of organizations of persons with disabilities in 3 regions here in Kenya, that is Nairobi, Kisumu, and Mombasa. And the main areas or the main aims were actually to improve advocacy and also policy engagement, enhance access to assistive technology, build digital literacy and storytelling capacity, improve financial sustainability through fundraising and resource mobilization. So in this particular project, just to be able to understand some of the challenges that OPDs go through so as to come up with better initiatives on how we can be able to support the OPDs, we carried out a need assessment through focus group discussions and also through online survey. And in the online survey, for example, we had around 209 OPDs that participated, gave their feedback, the challenges they face, and also some of the recommendations on how the challenges they are facing can actually be handled. During the focus group discussions, we had 84 OPDs that participated all across the 3 counties. And after that, after the need assessment that was both through focus group discussions and also through the online survey, that actually informed the contents of the training during the capacity building workshops that were done, where 59 OPDs, 59 organizations of persons with a disability actually attended, and they were supported. But from the engagement that we had from the engagement that we had with the OPDs, we realized that 118 out of the 209 that had actually participated in the online survey, most of them were, targeting or focusing on youth-aged people. That is between the age of 16 to 25. Only 2 OPDs out of the 209 that participated in the online survey were, focusing on the senior citizens that were above 65 years of age. And then 42% focused on exclusively females. Then the rest were both focused on both male and female. The thematic areas that most of the OPDs that were engaged in this particular project were that we had actually 127 of the OPDs focusing on livelihood and economic empowerment, 115 focusing on inclusive education, and 106 focusing on advocacy. Therefore, you realize that a big percentage of the OPDs were actually focusing on livelihood and economic empowerment. That is an indicator that indeed livelihood and the economic well-being of most of the members of these OPDs is actually a great challenge that needs to be overcome. Briefly, looking at the county-specific findings or regional-specific findings and challenges. For example, looking at Mombasa, we found out that high number of grassroots, Mombasa had actually high number of grassroots OPDs, but with very, very limited coordination. Then there was also lack of an umbrella body or an umbrella network that led to basically fragmented efforts and duplication. There was also very reduced government support under current administration, that is under current county administration. Then getting to Kisumu, we realized that there was, in Kisumu, we realized that there was high disability prevalence rates and more representation of rural OPDs. That means that OPDs that were participating in this particular program, most of them were actually rural. And, that was actually encouraging. A lack of also county level disability specific policies had resulted into minimal resource allocation to most of the OPDs. And most OPDs also operated with unclear mission and weak governance structure. Coming to Nairobi, most of the insights and the challenges that OPDs within Nairobi were facing is that more of them were established somehow as compared to those in Kisumu and Nairobi, with better exposure to policymakers and also private sector. They had high engagement in inclusive education and also policy advocacy as compared to the other 2 regions. They also demonstrated stronger governance and financial management than the other 2 regions. But then there are also cross-cutting findings. For example, in all the 3 counties, we had organizational and operational challenges across all the OPDs that are based in the 3 counties. We also had a challenge in terms of access to assistive technology, where over 70% of the OPDs reported no access to AT to support persons with a disability that they are serving. there were also low awareness on available assistive products, especially for sensory impairments. AT or assistive technology was also somehow perceived as costly and inaccessible across the three regions. Then also the other challenge that was cross-cutting was funding and sustainability, where about 41% of OPDs relied on membership subscription, which is actually a totally unstable income source. And we had 23% of them being able to access grants. 13% of all the OPDs that were engaged relied on partnership for them to be able to, sustain their activities. Coming to digital literacy and storytelling, which was also one of the cross-cutting challenges, most of the OPDs had no prior experience with AI tools, e.g., for example, the ChatGPT, limited presence on platforms like LinkedIn or Facebook for advocacy. That was one of the key challenges. Then coming to, after we had analyzed the challenges that the OPDs, they were facing across the three regions, we then had a capacity building workshop, which was actually informed by the challenges that had been identified by the OPDs across the three regions. So the workshop was delivered in all the three counties, and they actually included hands-on and practical sessions on smartphone as assistive technology, AI-powered grant writing, where members or representatives of the OPDs were introduced to ChatGPT, and also they were introduced on how they can be able to use AI in proposal development, also storytelling for advocacy, group dynamics and leadership. In this particular area, we address conflict resolution, vision clarity, and also strategic governance, which came out as one of the key challenges that the OPDs across the three regions were actually facing. Then the reported impact by the OPDs after that capacity building workshop was that participants participated and increased confidence in using digital skills and AI for proposal writing, understanding of how to integrate storytelling into fundraising and advocacy. Then there was also an increase in willingness to network and also form partnership so that they may be able to advance the agenda of inclusivity in all sectors. Then recommendations briefly, maybe for government, policymakers, for donors and NGOs. The OPDs recommended that for government and policymakers, there is need to enact county-specific disability legislation with dedicated budgets so that at least persons with a disability across all the regions are able to be catered for. Also, there was need to provide incentives, for example, business waivers, tax reliefs for inclusive services, just to be able to encourage persons with a disability to take part in businesses just as other citizens. Then also establish regular consultative platforms between OPDs and local governments across all the regions so that at least the governments can be able to know exactly what are the challenges that the OPDs are facing and also come up with solutions. Then to donors and NGOs, there is also the recommendation was that there is need to invest in structured mentorship in fundraising, AI tools, and also financial system, and also assistive technology, facilitate long-term partnership between OPDs and private sector actors, and also support peer learning networks and share digital platforms for visibility. Then for OPDs, prioritize. There is need actually for the OPDs to be able to prioritize leadership development and governance training, and also be able to develop strategic plans with clear roles, goals, and performance indicators to ensure that the OPDs are able to grow from one level to another. They also collaborate regionally to pool resources and avoid duplication, because one of the key challenges that came out clearly was duplication. A number of OPDs doing the same thing but separately. If at all they can be able to pull the resources and collaborate together, then obviously they will be able to avoid duplication. And also leverage on digital platforms that are available for visibility and also stakeholder engagement. Just in a summary, I can say that this particular project successfully catalyzed the capacity development of about 84 OPDs across Kenya by identifying their unique challenges and also delivering tailored support. Therefore, the partnership between KBTA and GDI Hub actually led to demonstrable progress in digital awareness, advocacy skills, and organizational sustainability. Thank you. Thank you very much.
Thank you so much, David. Really fantastic just to hear a little bit more about all the work and I guess all those learnings and reflections. We just had a question that's come up in the Q&A box, specifically related to the work in Kenya. So I wondered, David, if you might just be able to give us your feedback on it. So John has asked, what is the level of use of recent technology, smartphones, and bandwidth capacities of the regions where we are discussing here? I don't know if you want to just quickly respond to that, David.
Thank you, John Romano. The level of use of recent technology, smartphones, and bandwidth capabilities of the regions we are discussing here. Just to respond to this, I can say that there is still low, even though most of the OPDs are using smartphones, for example, but really they are not optimizing or maximizing the use of the smartphones. There are a lot of things that actually they are not able to navigate through in the smartphones. For example, during our workshops, most people did not know how actually a smartphone can be used as an assistive technology. Therefore, there is an opportunity here that we should actually be able to, train the OPDs on how they can make good or maximize on the use of the phones and the technologies that are available so that they may make actually more impact. Thank you.
Wonderful. Thanks so much for sharing that, David. I've also noticed we had a couple of comments in the question box just around some of the earlier slides. I think we had some connectivity issues, or there was something that went a little bit wrong, a little bit of blurring on some of the text. So I think it seems to improve. So apologies for anyone who was struggling to see that. We'll certainly share the slides after, but on all of them we have been discussing live as well. Currently just on the slide on the screen is some images that represent and showcase some of the work that took place in Kenya. And so these images are a mixture between some of the workshops that took place in terms of the really understanding the needs assessment, the capacity of building workshops where you can see groups of OPD leaders and representatives working together and really contributing to thinking around some of those key priorities. And there's also some images that are taken from the report launch. So all this work, there is a really interesting report that I'd really encourage everybody to read, and we shall put the links in the chat, and we shall also make sure we send it to you afterwards. And so this report was launched alongside Inclusive Africa in Nairobi back in the spring. So it was a really fantastic opportunity for us to bring together, and for the Kilimanjaro Blind Trust Africa to bring together the OPD leaders and contributors to the report together to share the results and findings, to really start talking about next steps, but also to bring together some of the global disability innovation and inclusion networks that were in Nairobi at that point for the Inclusive Africa Summit. So a fantastic way, I guess, just to celebrate and to share and to amplify the reach of the work. David, is there anything else you want to add on those photos, or does that about summarize the images that you've put there from the workshops and the launch in Nairobi?
Thank you, Louise. Maybe just to add that the pictures, actually, the photos that we see on the screen is they are actually the representation of the work that we did. And this was as a result of the feedback that we were getting. And we really appreciate all the OPDs that work together just to ensure that we get the feedback and also avail themselves to be able to be supported during the workshops. So we really appreciate, I just take this opportunity to appreciate all the OPDs that participated, both from the online survey up to the workshop. Thank you.
Yes, absolutely, David. Really echo that as well. Yeah, fantastic stuff. And for me personally, really interesting just to hear the volume of youth focused OPDs that were within the ecosystems and within the research that took place. And I think also from the learnings and the kind of outcomes of this, I think that willingness to form partnerships I've written down because I think that's quite key and quite important in terms of the power of those partnerships and the opportunity that maybe technology and assistive technology helps support those partnerships being developed and the impact being magnified from those. So some really interesting elements there. So I think now we've done a little bit of a whistle stop tour of Kenya. We shall move on to Pakistan. So I'm going to hand the floor over to Atif. So if you want to join us, Atif. And I think we'll be starting again with a video.
Hi, everyone.
In a country where nearly 10% of the population lives with a disability, equitable access to assistive technology, AT, remains a challenge. This is the story of how OPDs across Pakistan are leading change. The GDI Hub STEP, OPD Capacity Building and Impact Pilot, under the A2030 programme, funded by UK Aid, aimed to build OPD capacity and improve AT access through national and provincial interventions. 5 consultation sessions, 5 training workshops, held in Islamabad, Karachi, Nowshera, Quetta, Lahore. Limited access to affordable AT, weak implementation of disability laws, and societal stigma continue to hinder progress. To build sustainable impact, we trained and empowered OPDs across Pakistan through consultation sessions and training workshops. Enhanced OPD capacity and advocacy, strengthened provincial and national AT ecosystems, greater representation of PWDs in decision-making, actionable local partnerships for AT distribution and innovation. Despite the gains, much work remains. Funding gaps, lack of localized AT, and weak law enforcement continue to restrict inclusion. National AT policy needed, local production and subsidies for AT, inclusion of OPDs in policymaking, strengthening inclusive education and workplace accessibility. Join us in building a future where assistive technology is accessible, inclusive, and empowering for all.
Liz, may I continue from here?
Please do, absolutely, take the floor.
Yeah. Thank you very much, Liz, and it was wonderful presentation from Kenya. Actually, the situation which we have heard is almost the same in Pakistan, and we have almost similar experiences, except one thing that here in Pakistan, OPDs are connected with some kind of donors, or they are connected with technology providers. So what a surprise, like what we have seen in this whole process, that we have engaged 100 OPDs from 5 provinces, and we also engaged academia as well. We tried to include universities in our program so that they can also have a perspective of research side, that what are lacking of the assistive technology ecosystem in Pakistan. Secondly, we also include government representatives. Like we have in the ecosystem of AT, we have very clear social protection policies which are not being implemented because of lack of budgets or not understanding of the policies. So we tried to engage social welfare departments, Ministry of Education, and other relevant departments along with OPDs in every province, so that we can have a common understanding about the assistive technology, the system, how the demand side and the supply side. In this, you have seen the video that most of the workshops were conducted at the universities or engaging universities in the whole process. The one thing which we have seen the biggest challenge was the OPDs themselves. The people with disabilities associated with OPDs were not understanding the need and importance of assistive technology within their context. And secondly, if they understand it, for example, in a village, very far area, very hilly area, the use of wheelchair, they need a wheelchair, but wheelchair is not useful for them because of that hilly terrain. So that kind of challenges we have seen, that the need to have some kind of local innovations to have or to adapt assistive technology. Wheelchairs in some areas are not accessible or not useful at all. And similarly, if we provide some kind of assistive technology for the visually impaired person, the technology or the access to internet was not available at all or a very limited access. These kind of challenges we have seen in the whole process. But can you go to the next slides? Can I move to the next slide, please? Yeah, these are the three key findings, that the ecosystem or the IT landscape is disjoint. And because of the rural areas of OBDs living, existing in the rural areas have more challenges of infrastructure, stigma, and limited understanding of the issue. One more very interesting fact I will mention here, that I would like to, it's worth mentioning, that OPDs are still on the charity side. They're not coming out of the charity mindset. So that's why they still don't realize that if they have an assistive technology, they can live a better life, because they are still depending on the charities. So that was another issue which was addressed in the capacity building of OPDs. Then another issue, the lack of coordination. OPDs are not connected with the suppliers. Secondly, the policy gaps. We have a legislation intact to protect the rights of people with disabilities. But unfortunately, that was an eye opener during this working with GDI Hub and in this process, that we haven't mentioned anything about provision of required assistive technology in this legislation. Though we have mentioned about the social protection to maintain the disability and to attend the school and go to the workplace, but specifically nothing is mentioned about provision of assistive devices by the state. That was a big policy gap which we have analyzed. Then again, as I mentioned earlier, not only the lack of awareness at the level of OPDs, that also a lack of awareness at the level of government and other stakeholders. I will give you an example which we have seen very interesting. When we talk to the railway, the train system, they mentioned that disability is not their mandate, but we asked them whether people with disabilities travel on the train or not. Then there was a silence that yes, we need to understand how we can adapt the technology, how we can facilitate passengers with disabilities. But still, there's a big gap at this level of understanding and awareness. Then the capacity building work was required for OPDs particularly. We built their capacity to understand and advocate for the need of assistive technology within their constituencies, within decision makers and all the service providers. So can you go to the next, please? So these are the key findings, and what we have recommended to the government after these consultations and in this situation analysis, that we need to work on the policy gap to fill the policy gaps with the government, and especially the department dealing with the social protection and disaster management. They need to understand and they need to work on the policy gap of assistive technologies. Secondly, we recommended that OPDs need to be consulted at the policy level. Otherwise, the policy decisions will not be effective if they are not involved in decision-making processes. Third, we have advised to the academia that they need to conduct further in-depth research on the need of assistive technology according to different terrains, because Pakistan has a diversified landscape, mountains, oceanside, river, and the plains in Punjab. So we have different kind of trains. In these trains, in diversified localities, we need to have policies according to their infrastructure and the local needs. So these are the few recommendations. And here you can see a collage of the pictures which have been a very few selection of hundreds of pictures taken in this project. If you need to know more about it, I can explain. I'm very happy to explain it. Thank you very much.
Thank you so much, Atif, for sharing all those reflections. And I think really interesting. I mean, what you've talked there, I guess, in comparison to maybe, as we've heard earlier from Kenya, is maybe a little bit more that the big picture piece as well, and speaking to the wider stakeholders, the influencers, the decision makers, and how that overlap is really exceptionally important to enable OPDs and to enable those relationships to build, but also those opportunities between different parties to able to support the work that we're all kind of moving towards, and the spaces that we're all working towards, maybe in slightly different ways, but how that critical element is building those relationships. And often it's that starting the conversations and really seeing where those conversations can lead. So on the screen currently, there are 6 images that are taken from a variety of different activities that Atif has described to us that took place around Pakistan. And really these are showcasing a number of workshop sessions where there was a large group of OPD representatives or other stakeholders as well, really exploring some of these challenges and really understanding some of the individual needs, particularly from a regional perspective. So there are a number of images of kind of groups of people in conversation outside of the kind of university building. I assume that's university, looks like university, but correct me if I'm wrong, Atif. And some other discussion points where we've been able to kind of really kind of focus those consultation pieces. So Atif, was there anything else you wanted to share on those images, or does that about describe it?
You have very well described. That's just one thing that you rightly mentioned, that the National University of Science and Technology was our partner throughout the process. So that, and very interesting outcome of this project is that they are trying to establish a research center of excellence on assistive technology within the National University of Science and Technology. So very soon we are going to hear that good news that the state-of-the-art technology will be tested and developed in this university. And that would be a proud moment for all of my partners, GDI Hub, UCL, and all other partners, that FCDO, that finally, because of this, a very small initiative, but very critically very important, an assistive technology lab is going to start in the National University of Science and Technology in Pakistan.
How fantastic to hear that investment is happening, and that that there's that real continuation of kind of deep knowledge, research, and understanding in this space as well. So fantastic to hear that the alignment there. So there's been quite a number of questions come through on all sorts of topics that we've covered so far in the chat box. But I think maybe before we get to some of these more specific questions, so thank you everybody for contributing them over the course of our sharing of some of these programs. I think what we'll maybe do is we'll just bring one kind of major question to the panel to start a bit of a discussion, and then we can pull on some of these more specific questions that have come through. And we've also got Paul, who I mentioned earlier on, who's now joined the panel. So hopefully, Paul, you'll be able to help support in some of the answering of some of these questions. But we shall maybe make a start with the questions, and then we'll come to some more in the Q&A box a little later. So I really wanted to start with, and I feel a bit guilty because I feel like we're maybe jumping in the deep end here, but I think it would be good just to step back. So it would be fantastic to know from the panel kind of what is your reflection on the current strength of the OPD ecosystems. And I think it would be quite interesting to hear how you see they are kind of regionally, nationally, obviously even the individual areas you're working on, but also how you think that might compare in terms of the more international picture as well. So I appreciate that's a massive question, but but we like to challenge you. So I will come to start with to David, please, if possible. It'd be really brilliant just to hear your reflections on that, David.
Thank you, Louise. My network was a bit breaking. Kindly, if you could repeat the question.
Absolutely, of course I can. So we were asking, what's your reflection on the current strength of the OPD ecosystem? It'd be really interesting to hear around that, kind of how you feel that is currently kind of regionally and nationally within Kenya, but also maybe more internationally as well. How do you see the picture of the OPD ecosystems?
Thank you so much. My view on the OPD ecosystem, basically maybe with focus on regional, for example, the regions that we've worked with in this particular project, I may say that there is really need for concerted efforts and also have a multi-sectoral approach in addressing some of the challenges that the OPDs are facing. Because with a multi-sectoral approach, we will be able then to address most of these particular challenges. But then also there is need for capacity building of most of the OPDs so that they are able, to organize themselves. They are able to, carry out their organizational obligations clearly, have clear mission, have clear vision. Because most of these OPDs, for example, those that are from Kisumu, those that are actually from rural areas, they were formed without without clear vision and mission, for example. So once such OPDs have been in operation or in existence for some time, they may not have very, very clear vision. So this is something that has really affected most of the OPDs. But something else that is quite important to mention is the fact that even though there is information going around currently on assistive technology that the OPDs can use, there is still need for more sensitization on the available assistive technologies, for example, and also more training. Most of the OPDs really need more training and more capacity strengthening when it comes to assistive technology, because even though the assistive technology could be there, but the lack of our awareness on the availability of such technologies really hamper their access to such technologies, and therefore it really affects their operations and how they can actually be able to make use of the assistive technologies available. Then nationally, I may say that there are few organizations that have actually picked up, for example, the use of assistive technology, but they are few. Most of the other OPDs, they are actually still struggling on how they can actually be able to have clear mandates, clear vision, clear mission, and also on their efforts to access assistive technology. So once more awareness is created amongst OPDs on all these particular issues, I believe that there is a greater impact that OPDs are going to make when it comes to advocating for their rights and also for their own sustenance. Sustainability. Thank you.
Thank you so much, David. It would be fantastic, Paul, if you're able to put your camera and microphone on. We'll see if we can have you join the conversation. Is Paul able to join us? Paul, if you want to turn on your camera and microphone, ask to unmute. I think we're just going to see if we can get Paul to join us. 1 second, and then we'll come to you, Atif, after.
I'm Paulo Lang from Kisumu County in Kenya, and I'm a disability advocate and a DPO leader. I want to say that as an organization, Kenya Disabled Information Advisory Center, my organization and my members who are people with disability, and also other the DPOs I'm working with in the rural Kenya, we've benefited immensely from the training and capacity development we got from Kilimanjaro Blind Trust Africa. Through the workshops, we held the seminars, both in Kisumu and in Nairobi. And I want to say that we've benefited immensely through the trainings. It has enhanced our activities and operations as an organization and as individual members, whereby it has enhanced our cooperation and unity, since we can now we have improved communication. Again, where I want to applaud seriously is the training we got on resource mobilization and fundraising through proposal development. Actually, we've obtained a grant from Andy and the Inclusive Resilience Justice Fund on climate change, and we are focusing on non-economic losses and damages caused by adverse effects of climate change. And we are seeing more prospects where we are going to, through the skills we obtained in resource mobilization and fundraising through project development, we are going to access several grants and funds that is going to enhance our operation. We are able to work with other organizations of persons with disability and others, where through enhanced communication and through use of assistive technology. So I want to say that actually, as our work has been at least easing, we want to still encourage more trainings and more capacity development on AT, and also in resource mobilization and fundraising, so that we reach a wider spectrum of population of persons with disability and able to improve our own lives in Kenya and more so deep in the rural setup. Thank you so much.
Camera doesn't want to turn back on there. Hi, Paul. Thank you so much for sharing your reflections, and so fantastic to hear about your experience with the project and all the work that your OPD are doing, which sounds extensive and brilliant to hear that the capacity building has been of real value. So thank you so much for joining today. I shall move on to Atif. Maybe Atif, if you wanted to share a little bit about your reflections on, I guess, the state of the OPD ecosystems currently.
Yeah, thank you very much, Liz. Actually, the OPDs in South Asian region having the similar situations like lack of resources plus lack of understanding, and as I mentioned earlier, that they're still depending on the charity mindset or the charity models or the medical rehabilitation model. So a lot of capacity building is required for their understanding, to develop their understanding on the rights. Secondly, when we talk about the system technology, since the provision of the supply side is quite weaker, so their expectations are very low. They don't expect that they will get in a good quality assistive device what they actually need. So whatever is being provided is a very generic wheelchair, generic form of hearing aids. So that's the biggest challenge. Their expectations plus the availability of the supply side. So if we scale it up and we learn it from the regional level in the Asia Pacific or the global organization Pacific Disabilities, we have to connect them virtually to understand how the assistive technology is transforming the life of people with disabilities, especially if they want to attend school or if they want to go for work. So how it can impact their life. So that's a big gap we have seen among the understanding of OPDs to the need of assistive technology. Secondly, they are even if they have a capacity. So again, the supply side or the manufacturer, the investment companies, they are not still willing to invest in the assistive devices or assistive technology. So we have also tried to engage corporate sector and the manufacturers of assistive devices to connect them with OPDs. So there should be a mechanism that OPDs are engaged with the manufacturers or the suppliers of assistive technology so that they will get what they actually need, not a generic or a very general kind of a wheelchair for everyone. Thank you.
Thank you so much for sharing that, Atif. I've just looked at the time and realised we are rapidly running out of time, and we have a lot of questions that have also come in through our Q&A box. So in terms of the general type of questions that we've seen from the audience today, is a little bit of a mix. Some just more around the general insights that are shared and asking for a little bit more clarification or information, and some a little bit more focused around how OPDs might want to get involved, or how some of this work could be echoed in other regions or parts of the world as well. There's a couple of points maybe we'll just address live, and then I think what we'll probably do is ask the panel for their kind of closing reflections the last couple of minutes. So we will try and come back to some of these questions in our follow-up correspondence with the recording, etc. So I did notice there was a question around research around local production of AT. As part of the wider AT 2030 programme run by the Global Disability Innovation Hub, we are doing a lot of work in local production and AT. It wasn't such a feature of this particular project, but it is very much part of our wider ecosystem. So absolutely, we can share some more work. We can share some more on that. And I can see there's quite a lot of questions around how the OPDs are currently engaged, for example, with UN networks, etc. And so maybe we can address some of that in our follow-up correspondence as well. But in the last couple of minutes, I'd love to stop talking and hand back across to our panelists, really, because I think it'd be fantastic just to hear, I guess, a final thought or reflection from yourselves, and maybe it'd be nice to look at the future. So I guess what's next? How could OPDs be best supported? And maybe we're thinking about here around building capacity around advocacy and impact, or maybe just a reflection on what this work has enabled, and maybe where those next steps might be to continue to build on the progress made to date. So we shall probably go in the same order we started in, just because it's quite nice to keep a little bit of uniformity. So David, should we come to you first? So just really a minute on final reflections, really.
Thank you, Louise. Maybe my final reflection on what we can be able to do, maybe to improve the work that the OPDs are doing, and also just to improve on how they are doing their work. I suggest that, first of all, we need to really focus on strengthening their capacity, the leadership capacity of the OPDs, and also more training on resource mobilization and fundraising. Because without resources, without the ability to raise funds, they will not be able really to be sustainable. Therefore, the best thing that I will suggest is that we focus more, going forward, we could focus more on strengthening the capacity of the leadership of the OPDs, and also looking at how we can be able to strengthen their capacity to fundraise and mobilize resources so that they are able, to run their activities independently without, depending only on membership subscription. As I mentioned earlier, that is actually the major source of income in most of the OPDs. So once these two areas are actually, looked into, we can also as well look into training them on how they can be able to leverage the available assistive technologies so as to be able, first of all, to strengthen the capacities of the leadership, and also look at how they can be able to leverage on the assistive technology to be able to raise more funds and be sustainable. So those 2-3 areas, I believe, will be very, very crucial going forward for the OPDs. Thank you very much.
Thank you, David. Yeah, brilliant to hear those final reflections. Paul, would you like to come in and share a little bit around, I guess, your final reflections?
Thank you so much. Without repeating what Mr. Osenya said, actually, we've succeeded in mobilizing persons with a disability to form working groups and working organizations and groups I would like to ensure that now if we can focus on their capacity development in terms of leadership and governance and management skills, and also enhance their capacity in resource mobilization and fundraising through proposal development, focusing locally available resources, and enhancing their networks and collaboration, and also assist them in acquisition of artificial intelligence equipment, assistive technology equipment through modern ICT equipment and funds, so that they be trained alongside to be able to use them and also acquire them, because in Kenya and most of the rural setup, most persons with disabilities are poor, semi-illiterate or illiterate, and therefore these equipment are very expensive. So if they can be assisted to acquire them through subsidy and even free of charge, it will be better. And after a very short period, at least their capacity will be enhanced. They will be able to operate well and assist them actually and create a long-lasting impact. Thank you.
Thank you so much. Yeah, really powerful reflections there. Let's go to Atif. Atif, let's come to you. Could be closing us out.
Yeah, I will be very brief. Like what I understood from the whole process and this implementation and conducted this study and this research, that OPDs in developing countries need to learn the local innovative ideas to build their own assistive devices. So we need some kind of technical trainings and modules now for the OPD staff, OPD management, and people with disabilities associated with them, that how can they have their own local devices which are useful for them according to their infrastructure where they are living. So we need to build on it. Secondly, what we need to connect them with directly those supply systems, whether they are in the government, whether they are in the civil society or a corporate sector, so that they can have a faster access and have their voices to while they are negotiating on their assistive devices which they need. Thank you.
Thank you, everybody. Well, that's us 4 minutes over time. So thank you, everyone who stayed on a little bit longer. Really appreciate you taking the time to join us for the session today. Huge thank you to all of our panelists. It's been an absolute joy and pleasure to work with you all. So thank you so much for sharing the reflections live today. And also a big thank you to our captioner, Helen, who's been keeping you all across the action today as well. We will share some more information after the event, including the link to the recordings, the link to the 2 reports, and hopefully you'll be able to keep updated with the work that we're doing across this 80-20-30 programme and some of our wider work on the GDI Hub social channel. So please do follow that for a little bit more information about our wider portfolio. And I guess a final huge thanks to UK International Development that enabled us to do this project, to deliver this work. It's been a fantastic opportunity to work with some quite wide networks of OPDs in countries that we hadn't done before. So a real privilege. Thank you, everybody. Thank you for joining us. We shall leave it there, and until next time, bye.